The UK health system is facing the worst winter for emergency wait times as hospitals face soaring demand. At some hospitals, dozens of ambulances can be seen queuing outside with patients on board, waiting hours for admission.
This is what extreme pressure on the NHS looks like. More than 20 ambulances queuing outside A&E here in Stoke-on-Trent, each one with a patient inside, but there's no space in the hospital. Dennis Hodgkins is among the paramedics stuck waiting.
I'd say it's the worst we've seen ever. It's heartbreaking, really, because you're thinking of the patients on the vehicle you're trying to do your best for, and hopefully what we should be doing is offloading in 15 minutes. When we pull up, we see what we can see behind us here, and we know that patient could be waiting for hours, literally. I was only on a job a couple of weeks ago. We turned up to take a patient, and they'd been here 15 hours on the back of an ambulance waiting.
The pressure is relentless. At one point today, the number of ambulances queuing at this one hospital reached 32. That's more than half the ambulances covering the entire county of Staffordshire that were unable to respond to 999 calls because they were stuck here. And it's happening right across the country. This is one of several NHS hospital trusts to have declared a critical incident in the last few days as hospitals struggle to cope with the numbers of patients needing help. A spike in flu and Strep A cases, combined with a lack of social care places to discharge patients to, has led to warnings the NHS is under pressure like never before. And there's concern about planned further strike action by staff.
What winter has reminded us is that our health system is fragile, and it will continue to be fragile until we address those big issues of workforce, the fact that we don't have as much capital investment, the fact that we have never really made up the ground that we lost during the decade of austerity. That was a decade that meant we went into COVID with 100,000 vacancies. So things are going to be tough this winter. There'll be more trusts that will be declaring critical incidents.
The Department of Health and Social Care say they recognise the pressure the NHS is facing and say this winter they've provided an extra £500 million to speed up hospital discharge and free up beds. But staff and patients waiting here question if this is sustainable. Becky Johnson, Sky News, Stoke-on-Trent.